Good afternoon. I'm Dr. Press, and I'd like to welcome you to today's event that's sponsored by the St. Francis College Nursing Club, the Nurses Panel, Career Trajectories. Today you're going to hear from our 7 panelists, all nurses, some who are just beginning their nursing careers, some who are mid-career, and some who are longtime nurses with many years of experience. Each of our nurses will talk briefly about his or her current work in nursing, and those panelists with longer histories in nursing will describe how they got to where they are today, their nursing career trajectories. The nurse panelists today are Dr. Eleanor Kehoe, Mr. Dillon OSullivan, Miss Beatrice Adam, Professor Anne Bove, Miss Eileen Kehoe, Miss De'Vorah Levi, and Professor Charlyn Habeeb. Our first panelist is Dr. Eleanor Kehoe, chairperson of the Nursing Department at St. Francis College, and she will speak first.
Hi, everybody.
Let's give her a nice hand.
Good afternoon. First, I want to thank Dr. Press and the Nursing Club doing an excellent job getting this together. It really wasn't easy, and they all worked very hard.
Thank you, Dr. Keough.
How did I get here? Oh, long road. So I only have how many minutes, Estelle?
And each panelist only has 5 to 6 minutes.
Well, I'm over. You know, when she said the beginning of nursing, the middle of nursing, I'm at the end, okay? Actually, right now, as you know, my job now is chair of the Nursing Department, so it's academia, in the track of academia and nursing. But I had a long road coming up. I started out as a baby nurse many, many years ago and worked my way into, I was bedside nursing in pediatrics. I was in nursing supervisory, so I have certification as a nurse administrator, but my main background is pediatrics, and I am a pediatric certified nurse practitioner. I've been in and out of all different types of nursing, bedside, which is my favorite, I love the most. I've been in education, I've been in administration, and right now, this is the first time, I have to admit, the first time in 30 years, I only have one job. And that's because you guys are keeping me so busy. Other than that, I started out, I did my basic nursing at Long Island College Hospital, School of Nursing. It was an associate hospital-based degree. I did the night program because at the time, I went back to school in my early 30s, and at the time I had 4 children. So then when I left there, I was still working at St. Vincent's as a baby nurse, and I then transitioned over to an RN. Then I went for my bachelor's and master's in Pace University and had another child. And then I went to Adelphi University for my doctorate PhD in nursing, where I looked at parents who lost children to death more than 10 years ago following a chronic illness. And while I was at Adelphi, I also was able to do my post-certificate as a pediatric nurse practitioner. And I used all my degrees. I worked in private practice for 10 years. I loved it because I was back with the patients more than with administration. But I do like academia too, because I think we could give to you people what the positive things in nursing. And they're not always positive. It's, you know, it's a difficult road, and I think a lot of students think it's an easy thing and they're coming in for the money. Don't come in for the money. I'm glad you're getting paid well. We didn't. And I'm glad you're getting paid well, but it should really be a calling. It should be a vocation. And other than that, I mean, it's just putting like 30, 35 years into 5 minutes. Do we have questions now or later?
Later, we'll take questions later.
Okay, so.
Kristen, are you doing the time? Okay.
So that's about it for me. Bedside, nursing administration, academia, nurse practitioner.
Thank you, Dr. Kehoe. Next, we'll hear from Dillon OSullivan, one of our own graduates. He graduated in 2017 from the new RN traditional 4-year generic program. Dillon works as a staff RN in the ED department, in the ED at Methodist Hospital. And thank you so much, Dillon, for coming today.
Thank you. So I recently graduated in May 2017. I took my boards in July, and I was working in August. It is a lot working in the emergency department, but they have like a new residency program, which a lot of hospitals now offer. It's like a year-long process where like they give you more classroom time and a little bit more time to learn, and you're always with like a preceptor, which definitely helps. But in the ED or in like an emergency department, you see a lot. So like in one day, I could go see like a stroke, then a cardiac arrest, then maybe a heart attack. So like you could see a lot in one shift, or you go throughout the shift not seeing anything. But it's really cool. I like it there. The shift goes by super fast. That's what I love about the emergency department. Let me think.
We'll have a lot of questions. If you guys jot down questions now, so after each panelist talks, we'll have time for questions and answers. So if you have questions, jot them down now.
I did do an externship, which I recommend all you guys, like once you get to your junior year, definitely apply for externships, because they definitely help with getting a job, and you learn so much more. Like you're there maybe once or twice a week, and you're with like the same nurses, so they develop like a trust with you, and they let you do a lot more than sometimes what you're learning in clinicals. So definitely go out and get externships. It will help with the job.
And Dillon, you had an externship at Methodist
Yeah, I did.
while you were a student here.
Yep. And I know Bellevue offers them, NYU offers them, so just look around. That's pretty
Great.
much
Thank
it.
you so much, Dillon. Dillon, okay. Next up, we have Beatrice Adam. Ms. Adam is a nurse supervisor at the Nurse Family Partnership Program for the New York City Department of Health and Mental Hygiene. Thank you, Ms. Adam, for coming today.
Good morning, good afternoon, everyone. Thank you, Dr. Press, for inviting me here today. I've been a nurse, a registered nurse. Actually, Dillon talked about the externships. I started out at the Hunter School of Bellevue and did an externship program at Bellevue Hospital. So after that, I stayed on for about 1.5 years and went into community health. From then on, I actually applied for the city, and then it took like 2-3 years before they actually called you on for a public health nurse position. And I've been in this position as a nurse home visitor with the Nurse Family Partnership Program since it began in New York City with only 4 nurses and 1 supervisor. And now the program has expanded out to all 5 boroughs, and we even have vendor sites that also serve families that are in Long Island, and all the tri-state area. Happy to be here. The Nurse Family Partnership is a wonderful program for first-time moms, and we follow the moms during their pregnancy until the baby is 2 years old. And so it's a great opportunity to build that unique nursing experience. It's a unique experience in terms of community health nursing, and I definitely encourage everyone to look into it. And thank you for allowing me to stay, so I'll be here for a little bit longer. I'm here with my colleague De'Vorah Levy, so we'll be here with the nursing class later on.
Thank you, Beatrice. Ms. Adam and Ms. Levi will be coming to the community health nursing class today, and if you are not in that class, you're invited to come. They will be speaking on the Nurse Family Partnership in more depth. Thank you so much, Ms. Adam. Thank you. Next, we have our own Professor Anne Bove. She is an assistant professor here in the Nursing Department at St. Francis College. Thank you, Dr. Bove, for coming today.
I don't have my doctorate yet, but I started nursing in the 70s. I graduated from high school in 1974, and there weren't a whole lot of options for women that were definitively, provided or whatever. But as my guidance counselor told me, I did well in math and science. She said I should be a nurse. So she handed me a mimeograph sheet of paper, and on it said you could go to a nursing school, an associate program, or a 4-year program. So it was almost like I was looking at coupons here, and I'm thinking, where could I get the best, best for my dollar, so to speak. So I ended up going to CUNY. I went to Hunter, and I actually went to summer school every summer, worked my jobs, and tuition was free up until my last semester. And I was able to graduate 6 months early. So I graduated in January of '78, and I graduated January 8th, 1978, and they told us that we had to start working January 9th, or else we weren't guaranteed a job. So 50 of us went from graduation to working. And only recently I retired from Bellevue Hospital. But part of why I chose the hospital I worked at was also my belief system in healthcare. And I believe that healthcare is a right, it's not a privilege. It should be accessible to everybody. And I've been a strong advocate for single payer. And in regards to doing so, I worked in a neurosurgical unit when I first started. It was the tri-state receiving hospital for spinal cord injuries, and we were part of the Yale New Haven study. Then I worked in the medical ICU, and at that point in time is when we started to see what is now known as HIV disease. But we didn't know what it was, and public hospitals across the country were the epicenters, and Bellevue was the epicenter in New York City. Thankfully, it's now a chronic illness, but I saw prejudice that I hope I never, ever see again with regards to the treatment of patients. In that situation, it was HIV patients. I was staff nurse, head nurse, clinical instructor, and the men and women who trained me actually graduated from the Bellevue School of Nursing, some of them from the Mills School, the men, because they separated out men from women. And that sense of advocacy for the patient population that we serve was ingrained in me, and subsequently making sure that the people we worked with had the adequate training available to them so that subsequently they could practice at a level that our patient population deserved, which was the population at large. You have a nickel in your pocket or $1 billion in the bank, you get hit by a bus on First Avenue, you're going to come to Bellevue. It's a level 1 trauma center. So the idea of the equity of practice and the equity of care was ingrained in me, not just by them actually, but also by my mother, because she was a secretary at Queens, it was called Queens General. And she would talk about how very sick patients would bypass the hospital in South Jamaica, Queens, that shall actually close recently, but shall go nameless, and they would be brought to the public hospital because they didn't want the statistic added to their morbidity mortality framework. So as a little child, my earliest recollections was the importance of advocacy. So it's been one great adventure. I've never had I've always said I don't have to take a plane to see the world. I went to work, I saw the world. And understanding how we all have to be tolerant of each other, and we all have to respect each other's belief systems, and that's paramount in what we do every single day as nurses. So, and that you're part of a team, and that these people that we call patients are gracious enough to allow us to enter into their life system and be a part of a greater community. So it's a gift. Nursing is a gift. We have to advocate for our patients and advocate for our colleagues so we can give good care to our patients.
Thank you so much, Professor Beauvais. Next, we have Miss Eileen Kehoe, another one of our own, a 2016 St. Francis College nursing graduate. She currently works as a staff RN at Memorial Sloan Kettering Hospital. And thank you, Miss Kehoe.
Oh, thanks for having me. Hi, everyone. My name is Eileen. I am a new nurse. I'm about, I would say, 17 months by the bedside. It's been crazy 17 months. I started off, they give us a 3-month orientation. It's technically considered a med-surg floor that I work on, but since it's a cancer hospital, we have specialties on the floor. So I'm on a thoracic, urology, and GU floor. So we get a 3-month orientation with a preceptor. We try and stick to the same one, but they get vacation and we don't, so we don't always have the same person. And then we stay on days for I think about a month and a half, and then we go to nights. Nights is definitely a beautiful thing, I think. Dillon will get there soon. So then on nights, it's definitely a struggle, especially as a new nurse. You don't have half as much support as you need, but you learn everything. You're short-staffed a lot. You're the PCT, you're the UA, you're the RN, you're the doctor half the time. So it's definitely a learning experience. I do suggest if you can, do inpatient nursing for a little bit. You'll definitely get your hands on everything. I did not do an internship or an externship, but I definitely suggest it's the way to go, especially with landing jobs now. It's pretty hard out there to find a job sometimes. So if you can do it, and it was scary for me because my first day as a nurse on the floor, I'd never been with a patient without a colleague or, my instructor. So it was really hard when they're like, oh, go do this with your patient. I was like, by myself, So it's a lot easier to do when you've kind of been in the scene and seen it a little bit. And that's it. That's all I have to say.
Thank you, Ms. Kehoe. Next, we have Ms. De'Vorah Levi. Levy, a nurse home visitor who works also in the Nurse Family Partnership Program for the New York City Department of Health and Mental Hygiene. Thank you for coming today.
Thank you for having me. My name is Vora Levy, and public speaking is not my thing. But my passion for nursing allows me to present. So I would just go with the fact that I've been doing nursing for 24 years. And I went to Long Island College Hospital School of Nursing to receive my associate's degree in nursing. And then I went to St. Joseph's to get my bachelor's degree in nursing. My area that I've always wanted to cover was pediatric, maternal child really. But pediatric became my passion, and I went to work at Brooklyn Hospital as a new nurse straight into pediatrics, which a lot of places don't like to do. But Brooklyn Hospital was very welcoming to new nurses, and so I went straight to my specialty. While I was there for 15 years, working in pediatrics and in PICU, I encountered so many different admissions that I found to be unnecessary, and I did a lot of teaching with parents and relatives. And I always said that I wish that there was some program or something that was available to first-time parents so that their children would not end up in the hospital for overfeeding and acute life-threatening episode of vomiting, choking, and child abuse, drownings, and different things like that. So I said the first time that became available to me, I would leave and go pursue that. And I didn't do it the first time. The first time was with Miss Beatrice Adams. They did a pilot program called Nurse Family Partnership. At that time, I had a big family, and I was like, okay, this is a big chance, but I cannot take that chance with my family. So I decided to wait, and the opportunity came 4 years later, after they had already established a program, to work for a Nurse Family Partnership with the Department of Health and Mental Hygiene. And so I put my passion before money, because I took a great big pay cut going from working at Brooklyn Hospital to the Department of Health, so that I can advocate for parents, teach parents, and work side by side with them from pregnancy before 28 weeks until their child turns 2, doing nurse home visiting. I'm also CLC, a certified lactation counselor, and I've been with the Nurse Family Partnership for 10 years, and I love it. So that's basically all I have to present. And I'm going to try to find a way to get my master's in maternal child and teaching others how to see nursing as more than just bedside, which, by the way, I love, because I did that for years. But prevention is, to me, the best medicine. Okay?
Thank you so much. And last but not least, we have our own Professor Charlyn Habeeb, an adjunct professor in our nursing department here at St. Francis College. Welcome.
Thank you for having me. Good afternoon. I must start out by telling you that you are entering a work arena where nursing is the most trusted profession for 15 years now. So you're heading in the right track to make a difference in the lives of patients and their families and wherever you work. Where do I start? I started out nursing as a nursing assistant, and then I went back to school, became a nurse technician, went back, got my associate degree at Nassau Community College. Then I went on to St. Joseph's College, where I got my bachelor's degree and my master's in nursing education. I am a champion for student nurses. I currently work at Downstate Medical Center. I started out on the med-surg department, med-surg tele, and then I transferred recently to MICU. I work closely with the students at the College of Nursing there as a preceptor and mentor for them, and sometimes I do accept them for help them in the internship program. Now, why nursing for me? I enjoy giving care. And why nursing education? I enjoy preparing student nurses to help them to transition into the healthcare arena and make a difference in the lives of others. And also to effect change in a way where patients go to their level of a self-actualization, where they're able to function, to cope, and integrate back into society when they come to us for us to repair them in a sense or help them to become whole. Now, I got accepted at Wilkes University as my goal to get my PhD in nursing, so I should be starting that in January. And I look forward to continue to make a difference in both the lives of my patients and my students. Thank you.
Thank you, Professor Habib. Thank you to all the nurses today. Thank you. Now we have a few moments. We'll take questions from the audience.
By the externship, I kind of like met a couple people, and my externship was actually in the emergency department. So once they knew it was time for me to take like the NCLEX, they kind of already had everything set up. I didn't even have like a formal interview or anything. They just like transitioned me over from one position to the other.
That's why it's an excellent thing to do. If you can get an externship while you're a student, it really will help you in getting employment. What was the most important thing in success in passing the NCLEX?
I think doing a lot of questions definitely helped. And I think ATI, even though like when I was in school, I didn't like it at all. But once you start doing all the practice questions, like it starts getting a lot easier. So I think ATI, I did Kaplan, and also UWorld was really well, worked really well.
I did a lot of questions too, and I definitely went over the rationales, because even if you get the question right, a lot of the time you get it right for all the wrong reason. So make sure that you do go over the rationales, and I thought Kaplan, I didn't do ATI, but I heard it's great, but Kaplan, I thought the questions were worded similar in the way that they were set up. They were the most similar to me.
And we also had Hearst come last week or a couple of weeks ago to the Nursing Club event, and a lot of the students felt very positive about that. Does anybody that was there would like to speak about that? So this is the Hearst, is another review course for the NCLEX.
So Hearst came to speak to us about their review. They're holding a live review here in January and in May for 3 days. So they're going to go through this workbook, which is reviewing all the topics in school. They have an outline of it, and they gave us a discount of $75 for all St. Francis students.
And how much is the
$350. It's regularly $425. So they said it's really beneficial, and with the practice workbook, and then they give you links to practice questions, and you can do unlimited amount of questions. You can go to an unlimited amount of reviews also, which is included in the price. There's no extra payment for the reviews. And I think that's it. Am I missing anything?
And can anybody come to you? Where can they follow up? With Kathy? Okay.
Yes, with
Thank
Kathy.
you.
And I also have a brochure if anyone wants to see it too.
Okay,
about
great.
Hearst.
Dr. Kehoe would like to say something? Thanks, Hannah. Thank you very much.
What I want to say, I know everybody is not happy with ATI, but every review course you have, you're going to have pros and cons, and you have to understand that. So you are paying for ATI. We've gotten many complaints about your fees for ATI, but you're not using the resources enough, guys. You have excellent, excellent resources. You have books, which we all got books. You have practice exams. You have questions to go over. Use it. When we're going to have a 3-day live review, right? Ed Dillon, the guy was excellent. Mr. Brown. He's coming in. I don't know if we're going to have him, but you're going to have a 3-day live review. But before you get to that 3-day live review, use the product you're paying for. It's out there. They have so many resources that I didn't even know was available to the other day when we met with them. So don't get discouraged with it, because even if you had Hearst, you're going to find negatives and positives of no matter what review course you do. So just take advantage of what you have anyway.
And it's not too early to like start questions. You could just start doing them and do little by little.
Every day you should be doing questions.
Thank you. Alexandra?
Alexandra has a question.
My question is, how far in advance did you strictly study for the NCLEX? Like how many months? Like I'm sure you were
Can I answer
preparing.
that?
prior to it.
That was a long time for you, Dr. Kehoe.
I'm going to tell you guys, the first day you walk in, it's like the patient you admit, you're preparing for discharge, the day you admit them. The same day you walked in this school, you were told, do questions that day till
No,
the end.
I understand
Now go
that
ahead,
in, like,
Dillon, you give it
every
But
day.
now let's see what the students.
I was doing all like the ATI questions throughout like the whole nursing, like as I was in school. But I think my last semester, in the beginning of my last semester, I started doing like a lot of questions, like at least 75. I would try a day. So I don't know.
We have a question in the back. Is that Biandra? Yes, come, stand up. Somebody want to give her the microphone?
I have a question for Nurse Kehoe, the daughter. Hi.
Hi.
So I have a question. Since you mentioned that you didn't do any internships or externships, and I know that for us senior students, there's a lot of us who actually didn't get the opportunity to do internships and externships. So my question is, how difficult was it for you since you didn't have that exposure in getting a job?
Honestly, you definitely keep in touch with nurses that you do know. It helps a lot when they hand in your resume and stuff, and apply everywhere. Because every place is a learning experience. You'll take something away from it. I think I had, oh my gosh, I don't even know how many nurses just like, can you hand in my resume? And they'll do it. Just keep contacts with people. It's always good, because then people are always looking for something, but it's just hard because, you guys will graduate in May or December, and then how many other schools have new nurses going out at the same time, so it's really competitive. So just definitely keep contact with people. All
Thank
right?
you.
Yep,
And
you're
after
welcome.
you apply, you should like call human resources sometimes and just like keep reminding them, because sometimes you apply and like you don't hear anything. So if you call them, just say like, hey, I sent my resume in or something.
Yeah, that's true. My boss went on vacation for 3 weeks after I interviewed, so I was, sitting home thinking that I didn't get this job, but she just kind of didn't give the word before she went away. So definitely call, because you'll kind of be down in the dumps, and little do you know you have a job. So, all righty.
Okay, thank you.
So follow-up is important.
I wanted to ask, how was the interview process for you? Kehoe, Eileen.
I interviewed at 3 different hospitals. One hospital actually had a panel, which was really intimidating, but it was okay. Try and, be realistic. Don't go in there and be like, they'll know you're new, and you don't know everything. And honestly, I still don't know everything. I don't think I ever will. So the panel was a little intimidating. The one on human resources at Sloan Kettering that I have now, she was really nice. She just asked you more, what was your favorite, what was your least favorite clinical, things like that. Honestly, I think the worst questions are, tell me about yourself. And what would your friends say about you, and why should I hire you? Because how many times can you say that I'm great, and so definitely practice those questions. That's really it. They don't really ask a lot of content and scenario questions as a new grad, I learned, because honestly, you don't know. It's so different when you're in the hospital and you have, your teacher and this, that, and the other thing, and then when you're on your own. So I didn't get a lot of scenario questions, but definitely practice how great you are.
Can I just interject?
Yeah.
Yeah. It's always important that on interview, it's what you can offer. Don't interview the interviewer, okay? Because that really can turn how your potential acceptance into a hospital setting for a job is going to be. But remember, it's what you can provide as in terms of services, what you can give, as opposed to, because I've been in situations where and they've been new graduates, and they start questioning you in a way that before you start the interview process going. So it's always how you can best service the facility. All right? Thank you.
Ms. Adams, do you have anything to share, since you're a nurse supervisor and you're hiring nurses all the time?
It's been 20 3 years since I applied for like my nursing, my first nursing job. And I still have the stack of letters saying, thank you for applying, but, there's a hiring freeze right now. This was 1995.
Yeah.
And no one was hiring nurses. Whether you were new, whether you had experience, whatever it was going on, I didn't care. All I knew is I couldn't find a job. So don't get discouraged and do your homework. If you're applying for a particular hospital, don't apply just for the name. Know something about the hospital. Know something that's happening that's relative and that's up and coming, so that when you do get the question of why would you like to work for us, that you have something actual really, really, really good to offer them. And be real, because they can pick up when it's just like I'm sure you answered this question like 10 times already. So be genuine to the places that you actually submit your resumes to.
They do ask that a lot.
Dr. Kehoe has something to add?
I just want to add quickly, and I know I harp on this, appearance makes a difference. Don't go in dressed with your ripped jeans. You know how I love them. I'm not saying go dressed like you're going out on an evening somewhere. That probably is just the opposite as well. Dress professionally, though. It makes a difference. Look at you guys. The first time you meet somebody, what's your first impression stays with you forever. You can never change your first impression. So go in there looking professional, and I think it makes a big difference because we're going to have that graduate open house soon, and Brother Gregory came to our classrooms, and one of the things he discussed was dress. So make sure you look neat and clean and professional. That's just an added thing, because if I have people that come in to interview with me and they really look like they just dragged themselves out of bed, just another point,
Anybody else on the panel would like to add anything to that?
I just cannot.
Professor Habeeb?
I'll use this, thank you. Also, when you're seeking employment, look to see if they have RN residency program, because it will help you to transition. I did it as a new nurse, and it really helped me. So look and see if they have that to offer you in employment, okay?
Dr. Sweeney?
I just wanted to say that one of my friends was a hirer for a hospital, and I said, well, what's the secret? We're not getting students hired. She says, you better realize that every 3 months I throw out the whole pile of resumes.
Oh.
And she said, I said, well, what happened? She said, well, some people who persist, they get in the new pile. So I just offer that, don't give up. Send your resume in every 3 months or whatever, I don't know.
Keep calling Human Resources like Dillon had mentioned.
Like it could drive you crazy.
De'Vorah.
Okay, one of the things that I do interviewing, I assist in interviewing and reviewing the resumes, and also being able to ask the right questions. Always do your research, like she said, on the company or the place that you want to hire for, but let them bring forth the questions and you just be able to answer the best you can, being yourself. The other thing is basically whatever field you want, whatever area you want to go in, don't be disheartened about the ones that don't accept you. Just keep pushing, because that passion is going to come forth and you're going to get what you want. I haven't seen anyone that really had a certain area that they want to go to not really get that position when they have the passion for it. So, don't always settle. That's my whole thing.
Thank you. Any other questions? Kelsey?
What's something that, this is open to anyone, that you guys know now that you wish you would have known when you were in school or about to graduate?
I mean, I graduated in 1978, so when I look at what was happening prior to that, was the city was in crisis, and it said Ford to New York dropped dead. There was no money. The city almost went bankrupt. it's like my personal philosophy is I don't look back and say, oh, if you could do it all, there's no doing anything over again, because you'll probably make the same mistakes and the same whatever, all right? You always have to look forward because it's the future that we're moving towards, right? You don't want to move backwards, and that's what I'm a little bit worried about right now. But in terms of myself, I don't regret ever going into nursing. I don't regret going to the school I went to. I don't regret the hospital that I worked in. There's something, the elephant in the room with nursing is that it's very physically taxing. And there comes a point in time where you're not going to be able, even with the legislation that was recently passed with regards to safe patient handling, there is going to come a time when your body can't do certain things anymore. And it's not, and you have to be able to judge that and find where your niche then moves into. And that doesn't mean anybody's any of a lesser of an individual, but the point is that in nursing, but that you have to know what your limitations are in moving forward. And sometimes, not that I differ in terms of what my colleague's saying here, but you can't start off necessarily always in critical care or always in emergency medicine. You need to maybe start off in med-surg. And med-surg in some facilities is very different than med-surg in other facilities. So if you're working in, let's say, a hospital in New York City, in Manhattan, you're going to see a different acuity level than maybe you would see in more suburban areas. So, the idea is that, you have to be realistic and you have to be flexible. And, it's not to say that you shouldn't, I came from a working class family, if you want to call it that, and yes, I have a passion and a love for nursing, but I also knew that I needed to make some money. So the idea of employment is also important. And also realize that you're going to have to follow rules when you get your first job. Schedule may always not match what you want, but you're the new person on the block. So you're going to have to bend and be flexible. You can't push aside people who have shown dedication and commitment and who've established themselves. And also, nursing is in transition. It's been in transition forever. And, the clinical expertise, the training, still is set to the hospital setting. But hospitals are not getting reimbursed for educational departments. The department that I just left, when I first started back in the mid-'80s, we had 3 times the number of instructors that we have now. And that's why, in terms of looking at how you guys are going to transition, also be patient with your preceptors because of the fact that they may be working with limited resources as well.
Thank you, Professor Beauvais.
Yeah. Can I just add something to
Yes. Ms. Adam?
We have a lesson in Nurse Family Partnership that's called Each Child is Different. And so the classmate that you're sitting next to may end up getting the first job, and you might share like starting salaries, and then you may have an offer for another position that's a lesser pay. Don't think of that as like a downgrade.
Right.
You need to get your foot in the door, because that job that you kind of look down upon may open up even more opportunities that job that has 10 times salaries does for you. I had a colleague who, when I started out, went into community health because that was my passion, that's what I wanted. And she started out, she said, bedside nursing is not for me. And she went into pharmaceuticals. And we shared everything. So she was making probably $40,000 more than I was when I first started out, like with my first nursing position. She's happy doing what she does, and I'm still happy doing what I am. So think of that alone. Think of those things when you're going in for these positions, that the starting salary is not everything.
Thank you, Ms. Adam. Anyone else like to? De'Vorah?
I think
Eileen?
that it became a quick reality to me that you could be at a really great hospital, and when staff is down, it really comes on you. So if you're PCT, there's only one on the floor, and your patient's soiled, it's you. Because a lot of people, I remember in nursing school, like, oh, like, I'm not cleaning the patient, that's not my job. But
Yes, it is.
that's your job. And
That's right.
there are several times where there were 4 nurses in the room and no PCT to be found. So, like, you're never above that. And I think that's what a lot of people tend to forget. They do it because it is a good salary, but you're going to work your butt off for it. So never kind of forget that. I think that was a big reality for people, because you think, oh, like, there's going to be tons of PCTs, and, you know, like I said, there are days where we're the UA, that they're on break, and who's at the station at 3 in the morning, and that's us. You know, we're calling the other nurses. So just, I think, remember that it's always going to be, you're always going to have multiple hats that you're wearing, and at the end of the day, it does come back on you and your license. So, you know, if the patient complains, hey, I've been sitting here for an hour, that you're the one that kind of faces the repercussions. So don't think that you'll ever not have to do it.
Can I add just one point to that?
Dr. Kehoe?
I totally agree. I think so many people have gone into nursing for the salary. As I said before, I'm happy that you're getting good salaries. But many of them say, it's not my job. You know, guys, the best way to see a patient and take care of a patient is when you're changing them and when you're turning and positioning them. Best time to do assessment of skin, circulation, talk to them. You might be the only human touch they've had all day. It's so important that you don't step away and give everything away to somebody else. That's what nursing was doing for a while. We would do chest physical therapy. Oh no, we're giving it to the respiratory therapist. Pretty soon they were going to outsource themselves if they didn't have to do anything. Be by the patient as much as you can. Talk to them. Talk to their families. It's such an honor to have. It really is. You have
Yes, it
a
is.
privilege, whether it's bringing people into the world or helping them die peacefully. What a privilege you're going to have. All right?
Thank you. Professor
And-
Beauvais?
And in terms of looking at your, you know, if you see something, you know, I was acculturated by a bunch of men and women who came out of the Bellevue School of Nursing, who the history of that training system was such that advocacy played a huge role in terms of being responsible in terms of healthcare delivery. And if you look at Henry Street Settlement, you look at, you know, a lot of like the advocacy that was done in the early 1900s and through the years, you'll see a lot of those people that are hooked up to it were graduates of the Bellevue School of Nursing. So you got into trouble more for seeing something and not saying something than you did if you saw something and advocated for it. And the idea is that, you know, advocating safety, you know, safe needles, you know, that was a whole big deal because of HIV. I mean, I remember, as well as my colleagues, trying to get that type of, you know, safe needles. And I was told by the head of Central Supply that it was too costly. It was cheaper to treat somebody who actually contracts the disease than it is to get those products. Which is why a bunch of us not just me, but a whole cadre of nurses nationwide got together, and that's why you have federal legislation. The safe patient handling, I advocated for that, lobbied for that, as well as my colleagues from different nursing groups, and that's why it's in place right now. And we're in the process of trying to get safe staffing so that, you know, it's the idea of making sure that the right resources are there. But that's not going to happen because somebody else is going to do it, all right? It's going to happen because you do it. And being that today is Monday, November 6th, and tomorrow is Tuesday, November 7th, we know what tomorrow is, right? What is it?
Election day.
All right? And any of you who are eligible to vote, it is your responsibility because it's your vote that hires and fires whoever's in office, all right? And it's your responsibility as a citizen. A lot of people have died, not the American Revolution, but like the 1960s, in order to once again facilitate that you have that right to vote. So you go out there and exercise it. And remember that, you know, when you vote, you're not just voting for yourself, you're voting for the responsibility of the services that are necessary for the community at large. But, you know, that right to vote. And women, when did women get the right to vote? New York State, it was the year before, 1918, 1919, when women got the right to vote. So this is not something that we've always had, all right, in this country. Exercise it. Thank you.
Thank you, Professor Beauvais.
Thank you.
I don't know. I find it different, like the emotional, like part of it, because like you see the patient for such a little amount of time, and then they go upstairs. So I don't know. I feel like it's different than when you're on the floor and you're dealing with like the same patient. You go back into the same patient, and then in the ICU, you might have the same patient for like months.
That
So I
question
find it
probably would be
different.
better for Eileen.
Yeah.
being
Yes.
In a
Eileen,
cancer
yeah.
hospital. You want to address
Eileen,
that?
can you?
I guess I would say that I kind of, you get an attachment, especially since we're so like specialized, like I get a lot of the lung patients that do come in a lot. The urology patients, they tend to leave, they do surgery and then they head out. The lung patients, it's almost becoming like a hospice sort of center. And then when they leave, you kind of know that they're coming back. I think we kind of just try and do a good job building a relationship, but try and keep it kind of, you know, we ultimately know what's going to happen at this point, you know, and we try and be realistic. A lot of our time we advocate for them. They're not a DNR status, but they're going to, you know, like, so we try and encourage the conversation so that it's not like, you know, you're going to be going through this code and it's not going to be where you're coming back and, you know, going for a jog. Like, because a lot of people think that. So we do try and be realistic for the most part, but do build a relationship with them.
Can I address that too? I worked in pediatrics at St. Vincent's Hospital in Manhattan for many years, and a big clientele of ours was cystic fibrosis children. And at that time, I'm going back 20, 30 years ago, the lifespan was not long, but it's a chronic disease. So we got to know not only the child, we got to know the family, we got, you know, they were in and they were out. Yeah, you do have a lot of emotions, especially with children. It's not bad to cry. It's just you do have to keep some sort of control as well. To this day, I keep in touch with one of the moms over 30-some-odd years ago that her child died. It's just because they attach to you. So again, it depends. It depends where you're at. Like Dillon could say, I'm in the emergency room, but they move on. Eileen sees because she sees chronic patients. In pediatrics, if you see chronically ill patients, it's another whole ball game. Again, it all depends on the scenario you're at and working in and how much emotionally involvement there is. Does that help answer it a little?
Is it De'Vorah? Would you like to?
Okay. I worked in pediatrics for 15 years, and I've had different levels, and you need to be in contact with your emotional side, because that's the best way that you're going to function for the clients and be there for them when you identify how you feel about the situation. Doing pediatrics, I've had chronically ill, I've had cancer clients, babies. Doing case management, we work with them for almost 3 years, 2.5 years or more. So it depends on when we get them. So there's emotions there also, and you have to be able to identify them in order to know how you can help that client to the best of your ability. So identifying your own emotions has worked out, and we encourage that, especially for your mental health as well as the client's mental health. The other thing that I remember coming on in pediatrics, as a nurse for 10 years, I had a family, and they would come in and out because they had like 3 sickle cell children. And one of the things that they let me know was I was one of their first nurses. And when they came back through the years, I used to attend to them. But then just before I left, the family came back and they were like, you know, Nurse Levy, you are still the same, and we appreciate you being the same, because we feel that we have the best care that way, and that you know us and that you identify with us, and you've been there for our losses and our gains. So I took that as a compliment and also a way to check myself. So when I'm not being the best, when I'm stressed out with a whole bunch of whatever's going on, not enough nurses, not enough aides to help us, knowing that we're doing 10 different jobs, including the job that we're given, and to check myself so that that emotion is okay for what I put forth to the person. So that's a very good question, I think, and I think that's something that in nursing that we really need to pay attention to.
Thank you.
I'm a nurse 40 years, and I still work on the weekends at the VA in Manhattan in the surgical ICU. And, you know, death is never something, it's almost a sense of failure. You run a code, and you expect the patient to come back, but it doesn't always happen. So, you know, there's a letdown in terms of, did I do enough? You know, but the reality is that you start to wonder about yourself if you're not thinking, if you don't have a sense of feeling. And when you look at death, it's part of the continuum of life. And you just want to make sure that you're part of that continuum in a respectful and responsible way to the best of your ability to meet the needs of what that person wanted and what the family wanted, or the significant other. And family is defined in many different ways now. And but the thing is that if you've lost that sense of connection, then that's really something you need to really examine within yourself.
Thank you. We have time for one more question.
Okay, I would like to get into midwifery, and it's not an area that I hear a lot about anymore.
Well, I'll have to take that question since I am a nurse midwife. There's plenty of midwifery in New York City. The important thing is to get your first degree, your bachelor's degree, get some experience in maternal child, either working in the maternity unit on the floor as a staff RN, in labor and delivery, or mother-baby, NICU, a couple of years at least. And then there are a number of midwifery programs right here in New York. Downstate has an excellent program, NYU, Columbia. Those are master's degree programs. And there are a lot of opportunities. At Bellevue, where I was the associate director of nurse midwifery for many years. They have a very large midwifery service. You can either work in a hospital setting, in a service, part of a service, or you can move on to a private practice. There are collaboration agreements with physicians, because as midwives, we take care of low-risk, uncomplicated patients. And if patients should have any kind of a high-risk situation, medically or obstetrically complicated, need a C-section, then the obstetrician that we work with, we can work together. So I'd be very happy if you have more questions. You can always come see me in my office. But midwifery is alive and well. So thank you very much, all of you, for coming today, and of course thank our panelists for their wonderful, invaluable knowledge and their wonderful contribution to nursing. To give them a hand. Dr. Kehoe would like to say something?
Thank you. Yeah. Just 1 minute, I'm not going to hold you. I do have a class as well. I want to thank Dr. Press. I want to thank the Nursing Club. You're doing a wonderful job. You're coming together in a real good way and doing a lot of things, and informational things, and I know you're going to be doing outreach, and I'm really very proud of you. You're a really good group. Thanks.
Thank you. Thank you, Dr. Thank you, Dr. Kehoe. And Megan Kuhn and Hannah Berger are the co-presidents of our nursing club, and they really put a lot of work into this. We appreciate everything that they've done.